Hello, everyone. Just today, the CDC released this report called Risk Factors for Severe COVID-19 Amongst Adults Who Completed a Primary Vaccination Series. This was records from almost 500 healthcare facilities in the United States, recorded data from December of 2020 to October of 2021, so covering almost an entire year. So basically what they found out is they captured data on about 1.2 million people that had undergone vaccination in this year, and they found out that the risk of severe COVID-associated outcomes, which is qualified by hospitalization, was 0.015%, and death is 0.0033%, which is very rare. And they found out that every single person that had severe outcomes, so all persons with severe outcomes, had at least one risk factor, and almost 80% of the people who died had at least 4 risk factors. So basically, what this shows in a very large, robust group of 1.2 million people, if you've been vaccinated and you don't have one of these risk factors, your chance of having severe COVID was essentially 0. And then your chance of death if you didn't have at least 4 of them, then it was pretty low. So that's actually really good news. So let's look at what are these risk factors. So they looked at data from over 465 facilities in a large U.S. healthcare database. And they looked at the risk and frequency of developing severe COVID-19 outcomes after completing a complete vaccination series, which is defined as having 2 doses of either Pfizer or Moderna or a single dose of Johnson & Johnson more than 14 days before onset of illness, because if it was closer, then obviously the vaccine didn't have time to work. Severe outcomes were defined as hospitalization with a diagnosis of acute respiratory failure, need for non-invasive ventilation, so that means extra oxygen, admission to an ICU, or death. So among these, a total of 2,246 people developed COVID-19. 189 of them had severe outcomes, and 36 died. All right. So, what are the risk factors? Risk factors are age greater than 65, immunosuppression, and at least one of 6 other underlying factors. And what are they? Let's look at them. All right. In this study, age greater than 65 years, immunosuppression, diabetes, chronic kidney disease, cardiac disease, pulmonary disease, neurologic disease, and liver disease. So if you don't have any of these things and you're immunized, then your chance of having severe COVID-19 is basically 0, very close to 0. And if you have less than 4 of these things, then your chance of dying is very low, because 80% has 4 of these things. So what this goes to show you is you need to avoid having these complications. Now, none of us can avoid aging. That is unavoidable. We're all going to age, and hopefully we all live to be greater than 65. But these other things are avoidable. These are avoidable things. Immunosuppression is usually avoidable. Diabetes, usually avoidable. Chronic kidney disease is usually a complication of diabetes. Cardiac disease is avoidable with diet and exercise. Pulmonary disease is avoidable with generally with exercise and avoidance of smoking. Neurologic disease is usually avoidable as well. And liver disease is usually the result of fat intake causing fatty liver disease, and alcoholism, and other dietary factors usually lead into liver disease. So these are all avoidable things, and so everything other than 65 years are usually avoidable things. And I think that this outlines the fact that COVID has really been a wake-up call for a healthcare system and for individual health. It really goes to show that, and it's not just COVID-19, it's almost all diseases, all infectious diseases. Basically, the healthier you are, the more likely you are to have a good outcome from these kinds of things. So it's very important to look at things that prevent you from having these kinds of complications. So anyway, this is good news for most people. That if you don't have any of these diseases, then you're going to be fine. Unfortunately, the problem is that in the U.S., about half of adults have at least one of these comorbidities, which is quite unfortunate, and has to do with the lifestyle and the diet that we eat in the United States. Which hopefully in future videos we'll go over those. Started a little bit with the sugar series, and I encourage you guys to watch those, and we'll talk about other things as well.